Thank you, Dr. Zaid, and the Byatikram group, Somenda, for giving me this opportunity, the belief and honor. Unlike my co-fairs here in the dais, I'm very new to setting up a hospital. I have just, if you can say that I have succeeded in setting up a hospital that is a single super specialty urology and nephrology hospital. Yes, I have just set up the hospital. It is only a few months old. So successfully running the center, it will be few years or maybe decades down the line. When, as Dr. Zaid already said, that lots of hundreds of doctors, more than hundreds, even from different parts of country, and outside country also has come to my place to learn the trick of laser in urology, mostly in prosthetic diseases where I am concentrating right now. So it is actually an honor for us as a whole for the place, because earlier what I could feel while pursuing my super specialty degree in most prestigious Vijay Medical College and Hospital Ahmedabad, after securing 4th rank in a open super specialty entrance course, entrance exam, then what I felt, and lots of people also given me the idea that when people go outside seeking the advanced treatment like laparoscopy, lasers, then the treatment or the earlier treatment they received in our place were not respected that much. So from there, during the last 2 decades or so, we could compel some of the doctors from mainland India to come and get trained here. I see that as a success. Running the hospital, and once people from not only from Assam or from Northeast or from the country, even when this single specialty hospital will become a healthcare destination for the different parts of world, then we'll feel that it will be a successful journey. And how I developed this, because after coming maybe in the year 2011, I started going to different parts of state and even the Northeast to start operating the minimally invasive urological surgeries, which were not popular earlier. Most of the operations were done by open surgery. So I felt that I need to create an awareness. I addressed lots of CMEs, and then saw patients and operating also 4 or 5 years. Then one fine day, while doing a regular checkup, I got to know some gallbladder pathology suffering myself. You know, after 1 hour, I discovered myself in the chamber of our most respected Subhash Khanna sir. That day, I realized that you have to be best in something. Then only you can get the imagination and the belief of the people. Then I started developing my team. Now, you'll be happy to know that 6 urologists, 4 full-timer and 2 part-timer, they are working under me, and we have separated our works. Like I'm doing only prostate surgery, my colleagues like stone, one urologist, then cancer, 1 urologist, reconstruction, male urology, female urology, all are tackled by different urologists. And they were the strength of going me for a single super specialty. I faced lots of hurdles, even the bank people also, I had to duck lots of bouncers that how a single specialty will run. It is outside the city. I said, see, I will make a hospital, because thanks to my teaching at Ahmedabad, we have 4 kidney specific hospitals in the country, 2 at Ahmedabad. After that, 2 came up in Hyderabad. So that is the reason why they are ahead of us. So that were the strength, they were the strength. Then I even told the bank people, the manager of a big bank, that if you finance, the hospital will come up in 2 or 3 years time. If you do not finance also, I will make it. It may take 5 years. But finally, they agreed, they financed, and the hospital has come up. I seek blessings from all of you so that we can make it a world-level healthcare destination. Thank you.
I have another question that we are running the institute. Being a very busy practitioner, how do you strike a balance between your, as a clinical practitioner and your family life? And how do you create an environment for the other doctors also, so that they are not stressed out?
Yeah. So, as you have said, how I balance my work between my work and the hospital and the family. So, I have converted the hospital as my extension of family. So, yes, definitely, because today I'm here. My son is competing in a international chess competition at Delhi. He just defeated one competitor from, I think, Oman yesterday. So we have very less time with my family, but I try to spend the time as quality time, whatever I get. And yes, for the health part, because after some time, after working, Rajan sir, you must be knowing, Rajan sir one day told me that, Arup, by moving all around seeing the patient, you should dedicate some time to your health. Then maybe 4 years back, I started practicing yoga. Sir inspired me, and last year only I achieved Yoga Sadhak Award. So now, actually, I dedicate some time for my health also, and we are trying to create that environment in our hospital. And you'll be happy to know that every alternate Saturday, we are arranging yoga session for the doctors, for the paramedical staff, the patient attendants, everyone can join in that yoga session that will be going on every alternate Saturday at our place. And that will definitely help our doctors to think about their health for their mental and physical health. And at the same time, we are going for indoor play zone also, so that even the doctors can participate in some activities. Otherwise, as we all know, the doctors' health, I do not think most of the doctors are healthy, because they dedicate all the time seeing their patients in odd hours. They take food from most of the time outside, so they do not give much importance to health. So I am taking conscious effort to have a good health of myself, my colleague doctors, so that we can offer the best treatment to the patient. Thank you.
Thank you, Dr. Arup.